Hi, it's Dr. Queen. This time I wanted to talk about allergy immunotherapy. So you've come to see us, we've examined you, we've decided you probably have allergies, we've done allergy testing in the office, and now we've proven that you have allergies. Now you come back and we go over your results and we decide what are we going to do about it. And so it depends on how bad are your symptoms. Most people are going to come back with positive allergy tests. That's why we tested you. The question is, are your symptoms bad enough? Are the results bad enough to go with immunotherapy or allergy shots? And if you do have enough allergies and you have enough symptoms, which most people do, that's why they came here in the first place, we're usually going to recommend allergy immunotherapy. And most of the time we're talking about shots. In a second, I'll talk about an alternative, but the shots are the primary way to treat them. And what you do is you order the serums and we mix them up in the office just for you. Everybody's serum's completely different. They're tailor-made just for you. They'll have in the bottle exactly what you're allergic to and exactly how allergic you are to each individual allergen. And as you build those shots up, most people will come in once a week as they're building their shots. The serums are usually ready 1 week after you order them. We do not require office visits to get an allergy shot. It's walk-in. We try to make it as convenient as possible for allergy patients to get their shots. So you can walk in anytime during our shot hours, and we give you a copy of the shot hours so you know. It doesn't have to be the same time every day. It doesn't have to be the same day of the week, whenever it works for you. You can even come twice a week while you're building your shots up to maintenance dose. Why on earth would you want to do that? Because you get better faster. You also can go on vacation and take a couple weeks off. If you double up before and after, you don't get behind. So that allows you to stay on time. You can miss a week or two. That's okay. It's not going to mess things up. If you miss more than 2 weeks, we might bring your dosage down and build back up from there. If you have little minor reactions, we might adjust the dosage and come down a little bit and rebuild. Once you get to the maintenance dose, and people are going to ask, how long does that take? Well, it depends upon how allergic you were. Each allergen is going to have a certain number called the endpoint, which says how allergic you are. And depending on, it's going to range from 2 to 6. The 6s are going to take the longest. They could take up to 50 shots to get to the maintenance dose, where 2s will only take 10. So as you're building up, some allergens will actually reach maintenance dose before others. But when we say maintenance dose, we're talking about everything at maintenance dose. And that, could take up to a year, but it could also just be, as little as 10 shots. And we're between them. Now, once you get to the maintenance dose, you should have significant symptom control. And 98% of people in our practice have improvement in their allergy symptoms by the time they are at maintenance dose. Some people get better even after the first bottle, but we say you'll be better by the time you're at maintenance dose. You need to continue the shots up to the maintenance dose before you say, hey, it's not working. But that happens very, very infrequently. About 2% of people, aren't going to see improvement. Nothing's 100%. 98 is pretty good. If you're in those 2%, we're stopping the shots. We're not going to continue on shots forever that aren't working. If you're at maintenance dose and you're not improved, then we'll look for an alternative. But 98% of people are going to be better. So then we decide, when can you start stretching your shots out? And so you go to 2 weeks, and then you can go to 3 weeks and 4 weeks. And when we get you out to once a month, most people, or again, around 98% of people, can stop the shots and have a lifetime improvement in their allergy symptoms. How often can you stretch? On average, it's about a year for every week that you stretch. So most people are on the shots about 4 or 5 years typically. But I tell people, if they're feeling fine and their symptoms are well controlled, you can try to stretch your shots after 6 months. And if it doesn't work, you can always go back to the previous interval and then wait another season, another bottle, and then try it again. But most people, will get off the shots around 3 to 4 to 5 years and experience a lifetime improvement in their allergy symptoms. I do just want to say, we say improvement, okay? That does not mean cure. Technically, no one's ever cured of allergies. You still have that genetic tendency to be allergic. If you get exposed to some things that, we are not treating you for, you move to another location, you can develop allergies again. But being treated in Hampton Roads allows you to move most other places in the world and still do well, because we do have a lot of allergens here that we're treating you for.